My name is Harman Gill, and welcome to our latest edition of the procedural subsection. Today, we're going to start by doing a whole session on tips, tricks, how do you shave an extra 2 minutes and make your central line safer, faster, and most importantly, efficient. All right. We're going to work with a typical right IJ mannequin setup, and I want to start by introducing my main man, Sham.
Hey everybody, I'm Sham. I am a third-year resident at Mercy St. Vincent, Toledo, Ohio. Just want to give a huge shout out to our SimLab directors, Kathy and Chris. They've been really awesome in letting me use their space here. And yeah, let's do this, Harman.
All right. So, Sham, what we're going to start with is this thing called the most important section. All right. And that is the setup. In the setup, I think there are really two main things: ergonomics and the kit. Okay. So, owing to our WebEx and awesomeness of Sham, we've got the setup where I'm going to describe it and Sham's going to show it. All right. So, Sham, the first thing, setting up of your tray, your ultrasound, and your patient. Okay. So in our setup here, like we said, we're doing a right IJ. All right. So one of the first things you want is the tray has to be at the same level as your patient's shoulder and sort of that sternal to ear height. And also the tray and the kit has to be ipsilateral to the side that you're doing it. So in this scenario, we're doing a right IJ. It's going to be on your right side. So you're sort of doing one elbow's reach and none of this across this way, across that way. Cool?
Cool.
Excellent. Next is where you place your ultrasound. So this is what I call the V-shape arc of view, right? So ideally, like Sham has a perfect setup here, the ultrasound is on the same side as the kit. If for some reason your space is constrained, there's a lot of other things going on, you're in the ICU and there's like a ventilator and a CRRT machine, you can put it on the other side, but again, remember the V, okay? All you should need to do is look up and see it, and that's it, right? None of this business, none of this business, all right? Cool. And lastly, the height of the bed and where the patient is in the bed, right? So if you're in the ER, you know those handles that are on the side of the bed, they need to come down, right? There you go. If you're in the ICU, you have that little annoying board in between. You take it out, put it to the side, right? And you get your patient moved up in bed, all the way up to you, right? And the general height I recommend is having the patient's shoulders at the level of either your umbilicus or your hip, right there. Exactly, Sham. Perfect, all right? And of course, if for some reason your patient can't lay flat and you're doing a 30-degree angle view, then try and find a pocket on the oblique side where you have enough room to stand, you have enough room to get your ultrasound in and your kit. So you may have to take the bed and not have it in this like vertical position, but sort of move it this way so you can form a pocket in the corner. Make sense, Sham?
Makes sense.
All right, let's move on to the next part. Next part is what I like to call the Harman Gill lidocaine technique. All right, this is not patented, but if you cheat, you must give me 2 cents extra, all right? So let's show it. All right, so you all are gonna take your ultrasound and you're gonna take a survey view, right? You're gonna find out, in this situation, we're gonna find out where along the neck of the right side is a good side. Is it close to the mandible? Is it further closer down to the clavicle? And once you've found your perfect spot, this spot where ideally the vessel, that is the IJ, is lateral to the artery, right? You can sometimes move the patient's neck one side to the other to get the vein to move off of the artery. But once you've found the sweet spot, right? This is what I have learned and found to be superbly helpful. Alcohol prep pad, clean it up, draw about 5 cc's of 1% lidocaine, no epinephrine, and do a cc or 2 on the skin to leave a nice little skin wheel, and actually directly direct the rest of your lidocaine directly into the SCM. So you're leaving about a 2 to 3 cc depot injection of lidocaine, and that has 2 advantages. Number 1, since you've left a depot, you're having nice little local anesthesia just sort of dissipate into your patient, but also now you have a clear spot of what your perfect site was, so that when we're going to soon drape and put our fenestrated drape on, you're not you're putting the drape down in exactly the right location. You're saving that 2 seconds, that 2 minute, that annoying 5 minute redraping you potentially have to do because you missed the spot, right? Once everything is clean and draped and put down, you may not remember where the exact right spot was, but the clean lidocaine wheel that you make helps you sort of localize that spot. Make sense, Shyam?
Yeah, absolutely. That makes a lot of sense.
All right. And then the last part of our ergonomics section, let's just look and meet the kit. Shyam here has a very typical triple lumen kit. Now, I'll preface all of this by saying we're not paid by any of the companies here, but it's a very standard, typical central line kit here where you have your standard contents of the kit are labeled in the sheet. And if you're missing things like, you know, your ultrasound probe cover, your hat, your sterile ultrasound goop jelly, then please make sure that whatever's limiting in your kit, you grab those. Usually the things that are missing are those 3 claves on the side that you have to get. And sometimes even the central line dressing.
The probe cover a lot of times as well.
That's right, that's right. Okay, please also note the flushes that you need for the central line are, you have to get special sterile flushes. The routine flushes you get in the ED or the ICU, the contents, the actual saline inside the flush is sterile, but the actual flush coming out of the plasticine wrapper is not sterile. All right, so Shyam, since you're with the kit, I want you to sort of walk me through the kit. What do you see as you go in?
All right, so first thing I'm going to do is open it up. I'm going to do this outside open, not so sterilely necessarily because I've got a kit inside. First thing I see is going to be mask with a face shield and a hat with a cap. So I'm going to take this off just so everybody can hear me better. And we'll set this aside for now. Now, next thing I'm going to do is kind of open it up a little more. And I see looks like a gown, little towel in case you want to wash your hands and use this as a sterile towel.
There you go.
You got your gown here. In this particular kit, I actually have 2 different pieces. I think one of these has the drape and your kind of sterility stuff, and the other one has your actual kit. So before I throw this on and get the gloves and things on, get sterile, I'm going to continue to open stuff and drop it into my kit. We'll open up this half. This one I'm going to do a little more sterilely.
So ideally, you have someone helping you out, and you know, in the ED that can be pretty challenging sometimes. But even a LNA, a medical student, whoever is around, can, you know, be a great resource to just sterilely hand you things. And obviously, for the draping of the ultrasound probe itself, you're going to need a set of hands.
So because this has tint in it, I'm not going to actually do it, but you can clean up your patient. Prep. When I prep, I usually prep the right IJ, my right subclavian, and if I feel it may be a more challenging one, I'll also prep my left side of the patient as well, just so I have some extra sites and I don't have to do too much work later.
Efficiency, efficiency, efficiency.
Yep. All right, so it looks like on this side I've got my drape, which I'll get in just a second, but first thing I'll do is get gowned up.
And this is, while he's doing that, this kit is actually a very good kit because it has your drape, your kit, and your gown all in one thing. There may be kits that don't have everything so neatly put together. So if you have to get your individual components, then please keep that in mind.
All right, we'll just pretend like I've got a mask on as well.
Perfect. All right, so let's take a peek at the kit.